Fibrates are a class of drugs that lower triglyceride levels in the blood. They do this by decreasing the liver's synthesis of triglycerides, while also increasing triglyceride breakdown. In this video, I'll give you a visual way to remember everything you need to know about the fibrate drugs, their clinical uses, and their adverse effects. Let's get started. Welcome to our fiberglass factory, where we supply the best fiberglass for your electronic devices. I'll show you around. Just be careful not to touch anything. This place can get pretty dangerous. We'll start with our pride and joy, the fiberglass here. This fiberglass is our symbol for fibrates. Fiberglass for fibrates. I think this badge is being used to make fiber optics or something? Well, no matter. Our next few symbols will help you remember the specific fibrate drug names before we move on to their mechanism of action. Hey you, back up. Yeah, behind that fence there. We can't have you get too close to this fiber machine. By the way, doesn't this fence make you think of phenylfibrate? That's right, a fence for phenylfibrate, or fensofibrate. Well, now that we've gotten everything figured out down here, I want to tell you about my boss. Yep, it's Bezos, the Jeff Bezos. It shouldn't surprise you that the richest person in the world runs this fiberglass factory. Let Bezos here remind you of another fibrate drug, bezafibrate. Bezos for bezafibrate. Get it? As many of you well know, Jeff Bezos has done pretty well for himself these days. As you might expect, Bezos is chilling in his office stashed with gems. You know, just like the rest of us med students. By the way, these gems are our symbol for gemfibrozil, another one of the fibrate drugs. Get it? Gems for gemfibrozil? Now that you have the drug names down, let's talk next about what phenylfibrate, bezafibrate, and gemfibrozil actually do, shall we? Now, you can't get as rich as Jeff Bezos without having a crowd of paparazzi following you around everywhere. Yeah, just look at that paparazzi, clamoring outside his window. By the way, the paparazzi here should help you remember the mp4 alpha, a transcription factor activated by fibrates. Get it? It's the mp4 paparazzi. For mp4 alpha, mp4 is short for peroxisome proliferator activated receptor, and mp4 alpha is specifically involved in changing the expression of genes that affect lipid metabolism. Activating mp4 alpha increases lipid breakdown by increasing the expression of lipoprotein lipase. We'll talk more about this in our next symbol. Hang tight. So Jeff Bezos was trying to enjoy his simple lunch of bread and butter in peace, but it looks like the paparazzi has finally gotten onto his nerves. Oh man, looks like Bezos has lost both his appetite and his temper. He's picked up his butter knife, and now he's waving it angrily at the paparazzi. Coincidentally, this butter knife reminds me of lipoprotein lipase, since lipoprotein lipase works to cut fats, just like how a butter knife works by cutting into fats. And if this butter knife represents lipoprotein lipase, Bezos raising this butter knife should remind you of how lipid protein lipase is upregulated with fibrate use. This happens by way of the mp4 alpha activation that we just talked about. You see, if it wasn't for the paparazzi, Bezos wouldn't have had to threaten anyone by raising his butter knife. Let's talk next about the effect of increased lipoprotein lipase levels on triglyceride levels. You can imagine that the rate at which we produce fiberglass, requires this machine to be well oiled. Well, it's my job to make sure it is, with our special lubricating oil blend. We go through a lot each day, so I always keep 3 glass bottles of oil handy right on top of the machine. Hey, watch it! No touching! Now you've done it. You knocked all 3 bottles down. While I clean up this mess, you can use this image of 3 falling glass oil bottles to help you remember that fibrates decrease triglyceride levels. Get it? 3 for tri, and glass bottles for triglycerides, right? And these bottles are falling down, which should remind you that the triglyceride levels are lowered. This happens all thanks to increased lipoprotein lipase activity, which we've already covered. You see, lipoprotein lipase works to break down triglycerides into free fatty acids, so the net effect is a reduction in circulating triglyceride levels. Before we continue on to the other therapeutic effects of fibrates, you should know that fibrates are the most effective drug class for lowering triglyceride levels. Thus, it should make sense that they are a first-line treatment for hypertriglyceridemia. And just like any factory worker, I've got a headlamp. We recently made headlamps mandatory so that we could see our work area better. Coincidentally, this headlamp is our symbol for the elevation of HDL caused by fibrates. Since HDL stands for headlamp, right? Well, actually, HDL stands for high density lipoprotein, which you may remember as healthy or good cholesterol. Raising HDL levels is healthy because HDL helps clear cholesterol from the bloodstream. Fibrates elevate HDL levels by increasing HDL synthesis, which is an added cardiovascular benefit to using the drug. I can't figure out why Jeff Bezos is so upset about all of this publicity. Unless, perhaps, he's got something to hide. Like, whoa, do you see that? Is that a veil? It seems Bezos sure is hiding something, or should I say, someone. Shh, a married woman, eh, Bezos? Definitely paparazzi worthy. Let this lowered veil remind you of the decreased VLDL levels caused by fibrates. Get it? Since VLDL stands for veil, right? VLDL actually stands for very low density lipoproteins, and it is considered bad cholesterol because VLDL contributes to atherosclerosis, or the formation of fatty deposits along the walls of your blood vessels. In addition to increasing triglyceride breakdown by upregulating lipoprotein lipase, fibrate drugs also decrease hepatic synthesis of VLDL, which is a lipoprotein rich in triglycerides. Both of these contribute to the triglyceride lowering effects of fibrate therapies. Okay, now that we've covered the effect of fibrates on triglycerides, HDL, and VLDL levels, let's touch on some important side effects. So, as I was saying earlier, this machine needs some maintenance. Stop the machine! My muscular arm has gotten caught in the machine. Help me out. My muscles are getting crushed here. Unfortunate as my situation is, my crushed muscles remind me of the myopathy or muscle damage seen with fibrate use. Muscle damage can range from muscle pain to rhabdomyolysis, a serious breakdown of muscle tissue which can cause hemodynamic instability through the release of potassium. The mechanism of muscle damage is complicated, but the idea is that circulating lipid levels are important for the proper function of muscles. As such, many lipid modulating drugs can cause myopathy, including statins and fibrates. When these drugs are used together, they are highly likely to cause muscle damage, an important side effect to remember for test day. Hey, are you helping me or not? Hurry up and pull that lever with that liver-shaped handle to shut off the power. By the way, this liver-shaped lever is our recurring symbol for the liver, which should help you remember that hepatotoxicity is another adverse effect of fibrates. Again, the mechanism of liver injury here is complicated, but I like to think that all the changes in synthesis and metabolism of fats can cause damage to the liver. That lever also shut off the water cutting machine in the back. Those machines that use a jet of water to cut things. By the way, this water cutter is our symbol for the 7-alpha hydroxylase. Hydroxy for water, and the A suffix means to cut or split. Hydroxylases are enzymes that basically introduce water to cut things, similar to how this machine works. Fibrates inhibit 7-alpha hydroxylase, which you can remember as this water cutting machine getting turned off by the lever here. This isn't exactly a good thing, as we'll talk about next. So what was this water cutter cutting into anyway? Check out that stone slab it was cutting there. The cutter was turned off while it was cutting stones, which means we'll soon have a buildup of uncut stones. This stone buildup should remind you of the risk of gallstones with fibrate use. This is related to the inhibition of 7-alpha hydroxylase that we just discussed. Basically, 7-alpha hydroxylase is a key enzyme that catalyzes the rate-limiting step of bile synthesis. If you remember your physiology, you might recall that bile is the primary way our bodies get rid of cholesterol, preventing it from accumulating and forming stones in our gallbladder. Therefore, by blocking 7-alpha hydroxylase from working, we are blocking the formation of bile, allowing excess cholesterol to build up and form gallstones, just like stopping this water cutter causes a buildup of stones. We better get out of here before Bezos comes and chews me out. Let's recap quickly. Fenofibrate Bezafibrate and gemfibrozil are fibrate drugs, a class of drugs primarily used to lower triglyceride levels. Fibrates lower triglyceride levels by activating PPAR alpha, a transcription factor that upregulates or increases the expression of lipoprotein lipase. Lipoprotein lipase is an enzyme that then goes around cutting up triglycerides, breaking them down into free fatty acids. Fibrates also work to decrease production of VLDL and increase production of HDL, both of which help reduce triglyceride and cholesterol levels in your bloodstream. Fibrates are particularly potent for reducing triglyceride levels, which makes them first line agents in treating hypertriglyceridemia. Important side effects to look out for include myopathy, hepatotoxicity, and gallstone formation, which is caused by the inhibition of 7 alpha hydroxylase. Hope you enjoyed this tour because I'm pretty sure that after today, you're the last med student to ever step foot in this factory. See you in the next one.